What do you put on a surgical incision to make the scar less visible once it has healed? I'm Dr. Rodney Chan, and I'm a STARS plastic surgeon in San Antonio, Texas. How to make scars heal better? As a plastic surgeon, this is a question I get asked a lot. Even though a variety of creams, lotions, and oils advertise on the internet as effective scar prevention strategies, finding out the truth can be challenging for anyone, even for healthcare providers. In this short video, I'd like to give you 3 pointers to keep in mind if you are just having surgery or will be having surgery and is worried about your scar. First, always consult your surgeon before putting something on your fresh incision. Aside from yourself, your surgeon has the most vested interest in making you and your surgical incision look as good as possible. If you're my patient, your incision is indicative of my work, and I will do everything possible to make it look good. So when it comes to putting something on your incision that you think may be harmless, think twice, because sometimes these topical treatments can have adverse effects, and if that happens to increase your chance of getting an infection, your scar will surely actually be worse. Second, early incisions tend to be red and raised. With time, the redness and thickness of the scar will fade and get better on their own. So beware of someone who tells you that they can put this magical potion on your incision and the scar will miraculously go away. Remember, we're all different and we don't scar the same way. And more importantly, you don't really know whether the scar appearance is the result of that magical potion or just a matter of time. In fact, even a lot of published clinical studies don't consider this inherent bias. And 3, if you're looking for something that is proven, I would say compression and silicone sheeting are the only 2 modalities that have high-level evidence showing that it works. But before you go and grab this from your local drugstore or order them on Amazon, remember point number 1, don't do anything before consulting your surgeon. How about creams? A lot of people ask me about Mederma. First of all, what is it? Mederma is marketed as a scar gel and is available over the counter at most pharmacies. When you look deeper into it, however, it's essentially an onion extract in a gel form. Bottom line, I would not buy it. In 2006, a randomized double-blind split scar study was performed at Harvard Medical School comparing Mederma to petroleum ointment, like Vaseline, and essentially showed no difference. The study is powerful not because it comes out of Harvard, but because it used the proper control to see whether the scar treatment really made a difference, and it did not. The other product that people ask about is vitamin E, and unfortunately there's also no data that shows that there is consistent improvement. If you do have a scar that you don't like, don't be discouraged. Just because there's not a cream or ointment out there that you can buy to prevent scarring does not mean that there's nothing that can be done. In fact, both plastic surgeons and dermatologists specialize in helping people with scar conditions and have a variety of tools that can help you and your individual situation. So thank you for joining me today. If you like this video, be sure to check out our other tips on our channel and follow our social media on the STARS Plastic Surgery website. If you don't find what you're looking for, leave us a comment and that may be our next video. Thank you.